basic terminology.
Oh.
I think it starts with pathology. They're self-explanatory. I don't need to explain them, do I? They're going to be matching on your test. Then I started with neoplasms. You need to know the two main types, benign versus malignant. Know that the benign ones, they remain localized, and they have fairly well-defined borders, and they're usually slow growers. Know the examples that I gave you and what they mean. It's just pretty easy. Fibroma is just fibrous tissue. It kind of makes sense. Okay, so the second type is malignant. These are the ones that invade and destroy adjacent structures. They metastasize. What does metastasize mean?
Spread.
Good. They spread to different sites, and they're usually rapid growers. They're also considered poorly differentiated, which means what? They look different than the cells around them. Okay, know the two main types of malignant neoplasm. The first one is a carcinoma, and that's a neoplasm of epithelial tissue origin. The second type is a sarcoma, and that's from connective tissues. Okay, the cancer treatments or cures, surgery, it's just that. Chemotherapy is using drugs to poison the cells, and radiation therapy is radiation to break down the cells. Know the three ways. You're going to have to write this out and define them. The three ways that neoplasms spread, or pathways: seeding, lymphatic, and hematogenous. So know what those three are. Okay. The grades of cancer is not on your test. The stages are on your test. Stage 0 is the earliest form of cancer. Stage 1 is localized to one body part. Don't worry about 2 and 3, they're kind of alike. And stage 4, it's metastasized and spread throughout your body. Okay. So then we went into AIDS. Know what AIDS stands for? And it's from a retrovirus, which is an RNA virus. Common infections: pneumocystis carinii pneumonia is a fungus infection. Candidiasis is also a fungal infection, common to AIDS patients. And herpes is viral. Okay, neoplasms, common neoplasms. Kaposi's sarcoma, that affects usually the skin. Sometimes it goes to the GI tract, but it has those classic purple ulcerations on the skin. Okay, then we went into hepatitis. It's an inflammatory disease of the liver, and usually it's from a viral infection. Okay, no, Hep A. The first one. Know that this one is highly contagious, and it's transmitted through oral and fecal contact. Okay, Hep B is contracted by touching contaminated blood or blood products, or sometimes sexual contact. And this is the one the healthcare workers are most susceptible to. Know that as well. Hep C, it's mainly contracted by blood transfusions. If I didn't say something in your notes or whatever, then it's not going to be on your test. Okay, we don't worry about Hep D, Hep E, and Hep G. Okay, respiratory system. We went over a little review of respiratory system. Respiratory system is to take in oxygen and exhale carbon dioxide as waste. Okay, know that the trachea bifurcates at approximately T4, T5, which is called what? Good, carina. bifurcates to the right and left main bronchi, and then it just gets smaller and smaller. So respiration actually occurs at the true parenchyma, which is known as the what? Good, the alveoli of the lung. Okay, the double-walled membrane that surrounds the lung is called pleura. The visceral pleura is which one? Good, the inside layer, and the parietal pleura is the outside layer. Okay, you need to tell me why the chest images should be made erect if possible. The 3 reasons why. Lowers the diaphragm, demonstrates airflow levels, and it prevents engorgement of the heart and great vessels. So the chest area is considered what subject contrast? High, good. So, but we want to produce a long scale of image contrast. What do we do to do that? Good, you increase KVP to make more grays. Okay, to demonstrate fluid, is it the side up or side down if you're doing a decube? Good, it's the down side that would show fluid, it's the up side that would show air. All right, then we started out with congenital or hereditary diseases. Cystic fibrosis is a hereditary disease. It's characterized by thick mucus and secretion, mainly from your lungs. Radiographic appearance, I want you to know that one. It causes irregular thickening of the lung markings, and the chest is a barrel-looking chest because of hyperinflation of the lung. Hyaline membrane disease, don't worry about it, it's not on your test. Croup is not on your test. Pneumonia is the next one. Okay, don't worry about alveolar pneumonia. Bronchopneumonia, know that this is typically from a staphylococcal infection. What's a staph? Bacterial or viral? Good, bacterial. Okay, interstitial pneumonia, it's not on your test. Okay, TB. Primary TB is caused by Mycobacterium tuberculosis. Okay, the initial TB is called the primary lesion, and sometimes scar tissue develops around it. And where is that usually found, that scar tissue? Good, apices of the lung. So what would you do to demonstrate the apices? Good, you do a lordotic view of the lung. Okay, that's it for TB. Okay, pulmonary mycosis. That is a fungal infection. 2 most common ones you need to know: histoplasmosis, which is a fungal infection, and coccidiomycosis. That's not on your test, just no histoplasmosis. Okay, RSV is not on your test. COPD is not on your test. Chronic bronchitis is not on the test. Emphysema is on the test. Okay, radiographic appearance of emphysema, know that there's overinflated lungs, which means it's a minus density. And it also causes a flattening of the domes of the diaphragm. That's registry stuff. Asthma is not on your test. Pneumoconiosis, these are occupational lung diseases. First one is silicosis. It's from the inhalation of silica or quartz. Asbestosis, I did not put that on your test. Anthracosis, it's also known as coal workers or black lung. It's from inhaling high concentrations of coal dust. respiratory neoplasms. Okay, for the bronchiogenic carcinoma, know that the radiographic presentation, it usually consists of a solitary nodule, sometimes known as a coin lesion. That is bronchiogenic carcinoma. Don't worry about pulmonary Mets. Okay, vascular diseases of the lung. Know what a PE is. It's from a blood clot in what circulation? Good. The pulmonary arterial circulation, which is venous blood. Where does it usually originate, that clot? Good. It usually originates in the lower extremities of the legs. Okay, atelectasis. Atelectasis is an airless area of the lung. Radiographic appearance, also registry stuff. It's a white wedge-shaped area in the lung. Okay, pneumothorax. For pneumothorax, the radiographic appearance is what? Good, absence of bronchial markings. And so it's a increased or decreased attenuation? Decrease, because there's nothing there. So you would decrease your technique. So it's a destructive type of process. Okay, pleural fusion is accumulation of fluid in the pleural cavity. Radiographic appearance is blunting of the costophrenic angles. Okay, diaphragm paralysis. What kind of test do we do to demonstrate it? Good. To demonstrate it, they do a sniff test under fluoro. Okay, then we went into skeletal system. And you have a little handout. What do I want you to know from that? Know that the skeletal system is composed of 206 bones, and it's divided into axial skeleton, which know the parts of the axial skeleton: skull, thorax, and vertebral column. And the appendicular is 126 bones, and it is the shoulder girdle, upper limb, lower limb, and pelvic girdle. A lot of this stuff about the bone I didn't put in there because I think Terry's going over that in her biology class. I do want you to know periosteum. It's the tough, fibrous connective tissue that covers all bony surfaces, except for the articular surfaces. Know what the diaphysis is. It's the primary center of ossification, and the epiphysis is the secondary center of ossification. All that other stuff, like I said, I think Terry goes over that. Osteoclast and osteoblasts. Has she done that yet? She will. They are not on your test. Okay, congenital or hereditary diseases. Know that clubfoot is also known as Atelectasis. We're back in the chart. Spina bifida, it's incomplete closure of the spinal canal because the lamina failed to unite. Transitional vertebrae, it's just one that takes on the look or characteristics of one or both parts of the division above or below it. So C7, sometimes we have a cervical rib attached to C7. So an extra pair of ribs. Okay, osteopatrosis or osteosclerosis, it's known as the marble bone disease. Okay, radiographic appearance is increase in bone density, so it's what type of process? It's an additive process, good, so you would increase your exposure factors. Osteogenesis imperfecta is the brittle bone disease. And there's a degeneration of the bone, so you would decrease. It's a destructive process, you decrease your technique. Achondroplasia, that's the dwarfism or short stature. Congenital hip dysplasia, I did not put on your test. Rheumatoid arthritis, it's a chronic inflammatory disease. In radiographic appearance, early stages, there's soft tissue swelling, and late stages, there's joint destruction and deformity. Osteoarthritis, or DJD, degenerative joint disease. Radiographic appearance is there's a narrowing of the joint space, and sometimes they have the little bony spurs called osteophytes. Okay, Ankylosing Spondylitis. Okay, the other names for it are Murray-Strumple disease, bamboo or poker spine. And the spine becomes ankylosed, which means fused together. Bursitis is not on your test. Bacterial Osteomyelitis. It's inflammation of the bone and bone marrow. So you will see destruction of the bones, and they have a ragged, moth-eaten appearance with osteomyelitis. Osteoporosis is the loss of bone mass. Osteopenia is the beginning of the loss of bone mass. It's the precursor, they say. Radiographic appearance for both of them, it's a subtractive or destructive condition. Okay, osteomalacia, that's a condition in the adult where there's a lack of vitamin D. And rickets is the disease of infancy and childhood, which is the same thing. It's a lack of vitamin D. Radiographic appearance for both, there's a decrease in bone density. Okay, gout. This is a disorder where the patient has a problem metabolizing purine. And the radiographic appearance in the late stages, there's erosion, and it has this characteristic, looks like a rat bite marking. Okay, Paget's disease. Okay. Paget's disease, I'm gonna have to try and upload that. I really wanted to show you that because I've seen it on registry stuff. Paget's disease, at first there's an erosion that occurs, but second there's like these little white masses that develop like they're trying to correct this erosion. Usually it's in the skull, and it looks like cotton wool is what they describe it as, cotton wool appearance. That's when the bone starts to repair itself. Just keep in mind what I've seen on registry stuff, they have a picture of a skull with Paget's disease, and one of the questions is this, and this, and this, and the cotton balls were outside of the, like the skull was, the cotton balls were here. They were all, or cotton wool look. So with that one, those were artifacts from a pillow. So don't let them fool you if there's a picture of something and you think, oh, that's Paget's disease, because the white puppy things, if you see it outside of the skull, it's not Paget's disease, it's an artifact. Okay. All right. Osteochondrosis. It's the most common benign bone tumor. And it occurs in the epiphyseal plate, and it grows laterally from the epiphysis. I did not put endochondromas on your test. I didn't put giant cell tumors on your test. They just kind of all look alike. Osteomas, I didn't put on your test. I didn't put osteoma on the test either. Okay, simple bone cysts. They're fluid-filled cysts, so they appear as an ovolucent lesion. Sometimes it has a rim of sclerosis. What does sclerosis mean?
Hardening.
Like a hardening. So let's say the tumor was in the femur. So you see this rim of sclerosis, and then it's lucent all around it inside. So, but you see this rim of sclerosis. I should have shown you these slides. All right, malignant bone tumors. Why don't I do this? Let me, what is this? I made this class too short, is what I did. What are we over at 10:30? Something like that. At 11. Let's see how far I get through with this, and I kind of want to show you these slides. I think you should really see them. So anyway, I'll try and hurry through the review. Osteogenic sarcoma, I did not put on your test. I didn't put chondrosarcoma on the test either. They all kind of look alike. Ewing sarcoma. The registry seems to like kids stuff, kids diseases. I don't know why. But Ewing sarcoma is a primary malignant tumor. It arises in the bone marrow of long bones. So it's usually in children. It's a tumor of children and young adults. Okay, the process is destructive and it looks like onion skin or onion peel. Multiple myeloma is a highly malignant disease of plasma cells, and it creates a bone destruction with these punched out lesions, sometimes known as Swiss cheese. Don't worry about bone mets, it's not on your test. Okay, fractures. I did give you a handout on fractures. A lot of fractures are going to be on your registry, you guys. So this picture is on your test of the different fractures. You have to label them. Okay. So let me see specifically what I want you to know. All right. And then you have another one, common fractures. Don't worry about the stuff below that one sheet with the picture on it. Because a lot of it's in the next one. So you have a list of common fractures and dislocations. Okay, Colles fracture, we had this before. It's a fracture of the distal radius. Sometimes the ulna is involved as well. Navicular or scaphoid fracture. That is the most common fracture of the carpal bones. Why do we get that as the most common? Good, when you fall, you always put your hand out. A boxer's fracture is a fracture of the head or body of the fifth metacarpal. Fractures about the elbow. The most important thing about fractures about the elbow, we talked about this when we had that class, is to make sure that the humerus and foramen is in one horizontal plane. Okay, why? In the lateral view. So you can see the fat pads. Okay, so you'll see the fat pads. Okay, Montegia and Galizia, I've never heard of those. It was in your book, so I didn't put it on your test. Jones fracture is a common fracture of the foot. It's to the base of the fifth or tuberosity of the fifth metatarsal. A Potts fracture is a fracture of both the medial and lateral malleolus of the tibia and fibula. Trimalar is when all three are fractured, which is medial, lateral, and posterior malleolus. Don't worry about a compression fracture, that just makes sense. Pathologic fracture. This is one that occurs because of a weakness, like a tumor or something, and it causes a fracture. So they call it a pathologic fracture. Going on down, Jefferson fracture, it's a fracture of the atlas or C1. Okay. Hangman's fracture is a fracture of the axis or C2. And a clay shoveler's fracture is an avulsion type of fracture of the spinous process. What's avulsion fracture? Tearing away of the piece of bone. I didn't put seatbelt on fracture because most of us nowadays have lap belts. Spondylolisthesis. This is a defect in the pars, and it's without forward displacement, which is known as subluxation. Spondylolisthesis is the same thing, but there's forward slippage or displacement. Okay, let me go through these real fast, these slides. You really should see them. I promise I won't keep you long. Big test today? Yeah. She starts at noon, right?
I checked at 11:30.
Oh, is it?
Something like that.
Great. Any of you guys going to the Super Bowl? No? I heard a lot of people out there got tickets with the lottery thing.
The general got them,
A bunch
everyone
of
that
them.
applied for the raffle.
Anyone that applied got it? Really? I know Patty got it, she was screaming her head off. I know a bunch of people at St. Joe got it too. I think I would sell mine. I'd rather stay at home. think it doesn't go for this thing at 21. Does it? This is ridiculous. They're supposed to redo this room either in the spring or at the beginning of the summer. And supposedly that's going to be all new desks with computers in the desk. That's what they say. Oh my goodness.
The graduation thing is up now, I just looked.
It is up
For
there.
summer 2021?
Yeah.
Yeah, it's up.
Okay, good. Okay, so this first one, right where we left off, this is Ankylosing Spondylitis. You can see the fusion usually begins in the SI joints. You can just see the fusion along the sides here. Okay. And this is just showing a complete bamboo spine on this one. Okay, the next one, I didn't have a slide on bursitis, Bacterial Osteomielitis. You can see the destruction here. All this down here, so this is osteomyelitis. I call it the dragon moth-eaten appearance. This is just a regular osteoporosis. Just see how see-through the bones are. This is just showing a vertebroplasty, is what they sometimes do to try and put some structure in the bones. And you guys seen that vertebroplasty? I love the smell of that stuff.
It's like a nail salon.
I know, when they mix it together. So here's this is a lateral view with the vertebroplasty. Okay, osteomalacia. Okay, so it's just a degeneration of the bone because of lack of vitamin D. Okay. This is a kid, a hand with the kid that has rickets, same kind of thing, lack of vitamin D. This is before, and this is 3 months after high doses of vitamin D. Look how his bones have gotten more solid. Okay, this is gout. I don't know if I put it on- Yes, I did put on the test. So, it's bone destruction, as you can see here. And then this next one is that, they call it the rat bite appearance. Just looks like a rat bite. And gout. Okay, here's this Paget's disease one. So this is the early phase of Paget's disease. See how there's bone destruction? And then the reparative phase is when you get this, what looks like cotton wool appearance. What I was saying is, I've seen this on registry stuff where there's that, it goes way above the skull. So that would be a pillow artifact. If it's within the skull, it is Paget's disease. Okay, osteochondroma. Okay, this is the one that occurs in the epiphyseal plate and grows out laterally. Kind of weird looking, isn't it? That's osteochondroma. This is endochondroma, which I didn't put on your test. It's just a lucent tumor. There's another one, and this is a pathologic fracture from endochondroma. So that there was that lucent mass, and then it had a fracture. It caused a fracture, which they call pathologic. Giant cell tumors, I did not put those on your test. It kind of looks like everything else. It's a lucent looking tumor. Osteoma, that's the one I said that it looks like a little coin lesion sometimes. Osteoid osteoma, I did not put that on your test, but this is it here, and you can't really see it, you just see this, what they call a callus, because there's something going on, and then they took a magnified image of it, and you can see it right here. Simple bone cyst, like I said, a lot of these all look alike, they're just lucent cysts. Osteogenic sarcoma, I don't think I put that on there. Nope, I didn't put that on the test, but that's what this is. Another one, osteogenic sarcoma. So they're not all lucent looking, some of them are increased density. A chondrosarcoma, I did not put that on your test either, but chondro means what? For cartilage. So it's made up of cartilage type material. Ewing sarcoma, that's the one, it's the children or young adult disease. You just see these, looks like onion skin, according to whatever you mean, onion skin or onion peel appearance. Okay, multiple myeloma, I don't think I put that on the test. Did I?
You said you did.
Did I? And I want you to know about it. Okay, so for the multiple myeloma, I wanted you to know it looks like punched out lesions. Kind of looks like Swiss cheese, is what they say. Okay, here's another one with a pathologic fracture. And this is just bone mets. This is a PET scan showing bone mets everywhere. Okay, this one here, this is called a blowout mets. So it metastasized, some kind of tumor metastasized, and it blew out from the ileum. Osteoblastic metastasis, so you don't have to know it, but these are some little mets in here. Okay, fractures and healing process. So this is the one that you need to know for your test, this picture. Okay, what is this thing called? A rod, internal fixation. So this is a rod with internal fixation. You can see where the fracture was because see this growth? They call that a callus. So it's starting to mend or heal itself. Okay, so this is a normal union with the callus here. And this is a malleus union, so this person didn't come in to try and get it straightened first, so it's just growing back like that. This is a navicular fracture that wasn't tended to, so this is when it's like 20 years later. See where it didn't come together. Okay, this is just showing a little teeny fracture here. And 2 weeks later, they came back and you can see this callus growing around it. Anybody break a bone in here? Did you have a callus? You didn't feel the bump? Nobody?
I do, but I don't know if it's a callus or it's like the screws in the rod.
Oh, so they put a rod in there. Yeah, a lot of times you can feel the callus for a long time if you break your bones somewhere. Okay, so this is a Colles fracture or Colles fracture, fracture of the radius and the ulna in this one. Here's the lateral view of the Colles fracture. Here's a navicular fracture. It's hard to see. Evidently this person came in and they took an x-ray and they didn't see it, but you can see it right there. They came back a week later and you can see it's already starting to mend itself. Okay, this is a what fracture? Good. This is a boxer's fracture. These are fat pads, so there's a fracture in about the elbow here. You can see that lucency here of the fat pad. This is the Montevia. Don't worry about it. Never heard of it. This is the Jones fracture here. Fracture of the base of the 5th metatarsal. Here's a Potts fracture, medial and lateral malleolus. This is just a compression fracture of the vertebrae. Another pathologic fracture. Here's a tumor here, and it caused a fracture. Here's a Jefferson fracture, fracture of C1. A lot of times it involves both the posterior and anterior arches, however. Clay shoveler's fracture. This is kind of cool. So you see this spinous process here, but then you see this little thing here too. So when they did the lateral, see that little tip had broken off. I don't know why I put this on here. Anyway, you guys know the Scotty dog. Okay, spondylolisthesis. This is just spondylolisthesis. I have a problem saying that word because there's no slippage, no forward slippage. They're in line, but it is a defect in the pars. And this is spondylolisthesis with the forward slippage. I got through that pretty fast. That's it. All right, good luck on your test.